The morning huddle for theatre staff and another busy list.
2 for thoracics, 9 one.
Today I have 4 patients who have probably been waiting more than 2 years, who are having their hips and their knees replaced. These are patients who have not just painful arthritis, but arthritis that kind of completely takes over their life. There's studies that show that maybe up to a third of our patients have a quality of life score worse than death prior to their surgery. So these are patients who've been suffering for a very long time. The promise was in 12 weeks, and instead of 12 weeks, you're now looking at 12 to 24 months and beyond. The waiting list has increased dramatically, and it's going to be a huge, monumental task to really get back on top of it.
Long before COVID, Scotland had growing waiting lists, and in 2002, Scottish ministers saw a private hospital as a solution.
Stage for the NHS, the executive shells out to buy the troubled private HCI hospital.
HCI was bought for £37 million and repurposed to specialise in orthopaedic and cardiac care. 2 decades and a name change later, it now takes referrals from all but 3 of Scotland's health boards, treating patients from Orkney to the borders. Throughout the pandemic, the hospital has continued to expand. This wing, due to be completed by next summer, will house 5 new operating theatres, doubling the capacity in orthopaedics. While the Golden Jubilee doesn't have the additional pressure of an emergency department at its front door, it isn't immune to the issues facing other NHS hospitals.
I don't think there's many departments throughout Scotland that aren't touched by the staffing challenges at the moment, and it is a national pressure really, and there are various groups amongst all disciplines really looking at how we can do things differently in order to expedite the training of the staff that we need.
Here, the radiology departments are dealing with more complex examinations and an influx of patients.
Well over 100, 150 throughout the department alone, probably just on one day. My door's almost like a revolving door at times. We're as busy or not busier now post-COVID, so definitely a big difference in we're getting busier.
CT scan appointments are a fixture in James Tulip's diary. He's being monitored after having a tumour removed from his kidney 3 years ago. Urgent cancer care has been made a priority throughout the pandemic.
I got in under the drawbridge, as it were, and have been monitored carefully ever since, and I think, lucky. I've been dealt with quickly and efficiently and with care.
The colorectal department is another new addition, established last April to treat those waiting for procedures including colon and bowel surgery.
Cancer cases are taking precedence, but there are some patients who have had stomas formed where they need to have that reversed. Unfortunately, some patients have had to wait several years for that. And at the moment, we're heading towards about 120 robotic procedures that have been provided on this site. The robotic procedure is a bit slower, but the overall effects are it saves money eventually because we don't have patients in hospital for so long. And if there's more beds available, hopefully we'll be able to get more people through.
For those running these services, increasing capacity, skills and the workforce top the list of priorities, along with finding better ways of working faster to meet patient demand. Sharon Frew, STV News.